Okay, good morning, everyone. So my name is Michael. I've seen a lot of you in the field. I do a lot of stuff here. I'm actually a caregiver as well. So I do a lot of stuff here in the office, but I do have my set of male clients that I take care of, and I'm kind of like on a rotation. I also go out many times in the field to help with transfers, with Hoyer lifts, and so I just help out doing a lot of stuff. So they asked me to kind of give this class because I've actually been in the field. I know a lot of the difficulties that come up with when giving medications, and you're in a caregiver's role, and then the state of Ohio, they tell us that we have to abide by some guidelines, and there's a lot of gray areas many times when we have to be by the guidelines, but we have to help the client, and it can be rather difficult sometimes. So we're just going to go over some rules of thumb to make everything easier and to know what our scope of practice is, to know, okay, this is what's required of me, and this is kind of, this is what the state of Ohio says we cannot do, and then we find some way to work through difficult situations like that. So I'm going to ask to start out today, with a show of hands, who has just gotten off a shift tonight? Couple people work, and you guys are incredible. Working night shift and then coming here. So you have your coffee though, so that's good. Who are going on some shifts right after this class? Does anyone have a couple shifts? 2 people afterwards? Okay. All right. So we'll make it right till 10. So we'll get right into this now and start out administering medications from a caregiver's perspective. Now, when we talk about giving medications, if you take one thing from this session, I guess, there's a difference between self-administration of medication and administration of medication. And this is the important thing. Self-administration means, obviously, is when a patient can take their own medicine. So with the scope of practice, if you look at whenever you came through orientation, you have a binder that you had, and it says the scope of practice. For us to be there helping them, they have to somehow, some way be able to take their own medication themselves. And what we're doing is we're helping that process of the self-administration of the medication. Okay? Why does proper administration of medication matter? Well, in our field that we have, there are a lot of errors that can occur to caregivers. We're human, we can make mistakes, and in this field, when you give meds, you can give too many, you can give not the right amount, and it can cause problems. A few references here, books that we read. John Lowe says in his book, Caregiver Challenge, medication errors occur frequently in home care and can threaten the safety of patients. Another quote says, when not used appropriately, effectively, and safely, medications can have devastating consequences. And, unfortunately, you hear stories in this field where, maybe a family member doesn't pay attention and there's an overdose or something. And then, this is the big one, according to estimates, 1% to 2% of hospitalized patients are harmed from medication errors. This is from the Nursing Assistant Handbook. This is huge, but because we're talking about doctors that go to school for years, and nurses that normally can be very careful. But like I said, we're all human, so we're all subject to error. So that's why, if that's happening in the hospitals and stuff, we just want to be very careful when we're in the homes too, because it happens. So medication errors can cause harm to a patient's health, and unfortunately the consequences can be catastrophic with resulting in both declined health and sometimes in severe cases death. So we're talking about a very serious area that we come across, and that's why the state of Ohio and the government have put some laws into place to try to regulate that and make sure that everything's done according to plan, to try to keep those errors to a minimum. Okay? So we're going to go over today rules and precautions. And if you guys have any questions at all at any time, want to have a story, want to butt in, raise your hand. I'll call on you. Okay? Rules and precautions. So, first rule that you want to follow is ensure that the task is within the scope of practice. What happens is many times our client care managers go to a client before any caregivers reach a client. And they go and they make sure and they tell the family what the scope of practice is, what the caregivers can do with medications, which is, like I said at the beginning, helping with the self-medication of medications. So that's the scope of practice. Well, unfortunately, many times there's decline with the patient, or sometimes the families, they know what our scope of practice is, but they're pushing the boundaries because they don't want to do all the work. They want our caregivers to do a lot of the work. That happens, unfortunately, in a lot of situations. Or they could forget. They're busy people, and they forget what the scope of practice is. But we just want to make sure that it goes within our scope of practice. And again, there's a lot of different home health agencies out there, and a lot of different home health agencies that have different policies. So you get people coming from different places, hospitals, different home health policies, and when it comes to medication, there might be different differences. So we'll review later on what our scope of practice is, but just know that in our orientation in the handbook that you got, whenever you got hired, it's all listed there. But we will review it again today. And then always check the individual's plan of care and our own organization's policies and procedures. So a lot of people still don't know this, but when you clock into a shift, at the top right, you can click on the client care plan. I don't know if you've seen on ClearCare. And so if you're adding a new client last minute, you can clock in there, see the client's needs, and then see what the scope of practice is, what he does, what he needs, what medications he has. And I always try to do that before going into a shift, a lot of times beforehand, just to understand. So those are the first two things that we do. Check or make sure it's within the scope of practice, and then you're also checking the individual's plan of care, because a client with diabetes that has a plan of care will be very different from a client that has cancer treatment and medications for that, or Parkinson's. So always check plan of care. The main goal is to promote the patient's independence as much as possible. And I think this is one of the hardest things a caregiver goes through, because we're constantly, we walk into these homes, into these cases, and every situation is different. And we're there to help the client, we're there to help the patient, but at the same time we want to help them maintain their dignity. And we don't want them to feel like we're doing everything for them. We need to help them out. So you need that balance to be able to read the client, read the situation, and I think that can be difficult in many situations. Always use appropriate documentation. Always use appropriate documentation. Report, read, report, and record are the R's that we have. Always report, record. Joanne says many times, if you don't document, it didn't happen. And that is true with medications too. After you give, you hand the client the medication that they're supposed to take, you have to write down many times what time they took it. I know with my Parkinson's patients, that's important because when they get up, 15 minutes after they wake up, they have to have their medication. But sometimes they don't wake up. Sometimes it varies with Parkinson's patients. They'll wake up at 9 and then they'll swing another day. So the next day they'll wake up at 11:30. So their medication time is not the same every day, but it's around the schedule of where they wake up. So it's always appropriate, or we always need to document. And like Joanne says, if it's not documented, it didn't happen. Okay? Precautions. All right, we're getting into the nitty-gritty here. For an unlicensed person to assist with medications, the patient must be able to perform most of the tasks independently and ask for meds as needed. This is from the state of Ohio. The state of Ohio has all these home health companies, including Home Instead, and this is their law. They say, okay, for an unlicensed person, for care pros, if they need to assist with medications, the patient must be able to perform most of the tasks independently. So that means they have to be conscious, and they have to be able to, take the medication and take it themselves. Now that can be very difficult with some cases, and that's where I feel that it can be a gray area in many cases, because that's what the state of Ohio says. But then you go into these cases, and a lot of you see everything. Patients not being able to even know who they are. If you're with an Alzheimer's patient, they don't even know what medication is. How are they going to do that? So that's where we're in contact with the client care managers to try to properly make sure that they can do it independently. And I've done it. I had an Alzheimer's case right when I started. The guy had severe dementia, but a lot of times with Alzheimer's, they remember a lot of muscle memory. So the family sometimes, they were ready to drop home health and take him to a nursing home because they didn't know what to do. And he wouldn't take his medication. They would talk to him and ask him and plead with him until they were blue in the face. They say, "Dad, please take your medication, please take your medication." Well, medication is muscle memory. So one day, I went up to him, shook his hand when I went there. I said, "Salud." And he goes, "Oh, salud." And he drank his water. And then I put the medication in his hand, and he goes, "What is this?" "I don't know." And I said, "Oh!" And he took his medication like that. And he took it himself, and it's like, wow, the family was amazed. Wow. But muscle memory, and that we were able to keep the client because he was able, for months, all I had to do was, and he would do it. I wouldn't have to force feed him or try to fight with him. I just went, "Salud," and he took it. So that's amazing. There's always different ways in different cases, where we can talk with the client care manager, talk with the families, and try to work with them as best as possible. But we can never force people to take meds. That's the big thing. So caregivers are there to assist with the self-administration process only. So we're not able to, we're not going through the meds and taking the meds out, putting it in the containers, or finding the dosage. That's too risky. All we're doing is there's doses. It can be in their calendar cups or whatever, ready to give, and we're just passing it from where it has to go to the client, and they can take it. And a lot of the families should know, and the clients should know this when you get here. A lot of times, like I said, you have families that could fight you on it. Main rules and precautions. So now we're going to talk about the rights, the 5 right principles. This is a good rule of thumb for when giving medication. You just want to remember it. Number 1, the right individual. If you're in the home, you're like, right individual is the only person there. But like if you're in the nursing home, that could be different. Or if there's multiple people in the home, you want to make sure it's the right person. So first is the right individual that you want to remember. Secondly is the right time. So you want to make sure it's the right time to give it. Double check for time, assigned by a doctor. Many times when they go to a doctor visit, then the times change depending on their case. So you want to make sure the client care plan is updated. Or if you're walking right into a shift, and you know nothing about it, you just want to make sure that normally all that information is on the diary with times for medication. We're trying to start a system here where all the medicine or medical changes or any changes on the care plan are right in the front binder of the journal. Because many times, you walk in and you can feel lost because everything's unorganized, and you go through the client care plan, but you're like, okay, what's going on? It's a mess. So we're trying to keep everybody on board, and that's another reason it's important to journal. Because if a caregiver doesn't know what's going on, you want to think hopefully they can go back to the notes and read your notes and be like, okay, I see what Michael did before. Oh, but that's what he did with the medicine, and try to explain it a little bit better. But that information should always be in the client care plan. Review if meds are given with a meal, 30 minutes before or after or by itself. This is a lot of times with most morning and evening medicines, it's always with a meal. So you always want to make sure the medicine's given at the right time. And then there's medicines that it has to be exactly an hour after lunch. So, because it has to be after they digest. Okay? All right, right individual, right time. Next thing we need to remember is the right medication. Okay? Always double check. And I had someone say, well, how are we supposed to double check if we're not even supposed to look at the medicine? All we're doing is passing it. That's a valid question. That's a good question. I think, we're not, if you're there with a client long term, you know his routine. So you can tell if something's off a little bit. You can see, okay, he always takes his yellow pill. He doesn't have a yellow pill. What? Okay. I know I'm not supposed to do that, but maybe he forgot, and just remind that's something, we're an extra set of eyes and ears for the clients. So always double check. The right amount. Make sure it's the right amount. Grams, drops, microgram. Make sure it's the right amount. Again, this goes back to the last thing I said. Always double check. Because you can eyeball it, and if you're with a long-term client, it's not right. Or, poor Mrs. Jones has dementia, and, she's pouring a lot. It's like, oh, wait a minute. Make sure it's the right amount. The right route is the route of administration in which a drug enters your system. So, different ways medicines are taken. You just want to review it. So, orally, you take capsules and tablets, through the mouth, like liquids. Nasal, is anyone familiar with nebulizers that people take that, they can breathe in a lot of the medication? Many times with clients that have ALS or that have problems swallowing, that can't process or digest or anything, they use the nasal medication. And that is also, they're like, okay, well, do I hand them the medication? What happens? Many times it's already pre-dosed. So we'll get to that in a second. Nebulizers, inhalers, skin. How are, this is a question for you guys, how is medicine given through the skin?
Topical medicine.
Yep. Creamers or patches many times. The patches that are given, that's through skin. So you got the patches, the skin spray, ointments and creams, and then the eyes and ears. You deal with drops for the eyes and ears that you have. Okay. Medication steps. Whenever you're giving medication, you always want to remember to wash your hands, have the right hygiene. Use gloves if needed. Explain the procedure before administering. I know with some clients, giving medication is a big deal, because it's a lot for them to take their medication. So you need to, if there's a lot going on, if they're in the home or if there's a loud noise, they need to be quiet because they need to know, hey, Mr. Jones, we're going to give you your medicine, because they're startled. So just make sure you explain before giving the medicine. We encourage a balance of independence and safety. That's what I talked about beforehand, where I want them to know that I can help them if they need help. Like if they can't grab it or something, we're there to help them. But if they're dropping it and then they don't have their medicine, that's not a good situation. So that's where the caregiver, the care pro should have the understanding and wisdom to just understand the environment, read the room, read the environment, and see how we can help. Avoid distractions in giving medications. Assist the medications right after preparing them. So right when they get the medication, give it to them. Don't have the medication sit out, because that can lead to maybe forgetting or spilling, or medications have an expiration date too. So you don't, especially if it's liquid, don't let it sit out. Give it to them right after preparing them. Make sure medications are administered in a private environment, especially when family comes, and it can be embarrassing. The guests are there, family's there, and you're helping them take medication. It could be private. So if there's a big gathering, you could excuse yourself from the room and say, okay, we'll be right back. I'm gonna help Mrs. Jones, Mr. Jones, situation. Never leave medications unattended. And this is the big one. Report and record any errors that you might come across. And I'll talk about this for a second. Shows how I'm human. I'm human. A year and a half ago, I forgot. I had a Parkinson's client. It was the time I totally forgot. The shift ends, and I was like, I didn't have the medication. I had to eat a big slice of humble pie, call the family, call the caregiver. I'm sorry, this is what happened. And so we adjusted it, we wrote it down. But, you want to do everything in your power not to make it happen. But if you forget, let the family know, because there could be severe complications if they don't know. And, you'd be like, oh, it's my job. It's your job to do it, but you want to let them know, just so that in some cases they know how to proceed, especially in some severe cases. If you're in the nursing home, you can let the nurse or supervisor know. And if you're here at home instead, you could let the client care manager know. Like, this is the situation. Or there's another time where my client, Parkinson's, spilled all the medication, and it was tiny pills. And I couldn't get a hold of the wife, and I couldn't find the medicine. What do? The client care manager came to the house. She talked to the wife on the phone. She got a new amount, and then we were able to give it again. So if there's any problems like that, know that there are a lot of client care managers here. That's their job. Any situations, any problems. So you are more than welcome to call them and let them know. And then record any observable changes in behavior. Report to client care manager. A lot of times, we're there for an extra set of eyes and ears. So we see the decline many times that the doctors and nurses don't see. And a lot of times if I'm with a long-term client that I've been with a long time, I'm the one that'll talk to the doctors and nurses about their signs and symptoms, because the family's not there. I'm the one that's there. So I'll just tell what I record, and if there's a decline, that's our responsibility to let them know that. Okay. Miscellaneous management. So, miscellaneous management All right, this is a big one. Due to several risk factors, caregivers may not cut or crush pills, tablets for clients. This is a big one. We had a session and we had like a 20-minute discussion about this. I know, I'm right there with you. Like it's frustrating. You know, we cannot do it. We can't crush pills, tablets for clients. But the family, you know, if they're there, can do it. And all we're doing is then giving it to the client for him to take, okay? But this is a big one. This is a big flag that could be, just know the state of Ohio says this, and many times it's frustrating for me, you know, because it's just like, I want to be able to do it, but this is the law with the state of Ohio. We're not able to do that. That's just how it is. Feeding. Caregivers may not place medication in a patient's mouth. Now, remember how I said we talked about the gray areas before? Right at the beginning, and I said there's a lot of gray areas. This is one of them. Because there's the law in the state of Ohio, and then there's a job that we have to do, right? So, what I would say is do everything in your best power to have the client take the medication themselves. Like some clients that have Parkinson's, that if you have to, help raise his hand, you know, if you have to, and help take it. But this is from the state of Ohio, again, that says caregivers may not place medication in the patient's mouth. So we have to find a way to work with that and try to give it to the client as best we can. And if the client, you know, if their hands are shaking, they can't do it, try to get them a weighted spoon, try to put it there, and then maybe help guide them if we can. So personally, most frustrating thing that I have to do, but I've been more aware of it and trying to help as best as I can with the independence of our clients so that they can take it. And because that's the guidelines that our policy and with the state of Ohio, that's what we have. Okay? So those are the big no's. No cutting or crushing pills for clients. No placing medication in a patient's mouth. We can assist by opening the bottle or package and immediately handing it to the client. We can do that. We're there to hand, so we're helping again with the self-medication. We're not medicating them. See how that all came back together? We're not giving it to them. We're just handing it to them so that they can take it. That's the big key.
So can you shake it out in the client's hand?
Mm-hmm.
You know, when you open in the bottle, can you shake the medication out in their hands?
Mm-hmm.
It's in their hands, so they can take it.
that's another gray area, because you don't want to, you don't want to start giving it to them. That's a gray area.
Oh.
So I would say it depends on the situation too, you know, because if all right, I'll give you two scenarios. One scenario is Mr. Jones says, help me shake this. You know, he says, how many do I take today? 2, 3, 4, 5? It's a situation where you're like, whoa. I don't know there. I'm going to call the client care manager. Because if you don't even know it's not written down, well, you know, let's see. If you're with Mr. Jones, you know he takes one a day, every day, been with him 6 months. Just trying to get one, you know, trying to get it down. All right, Mr. I'm going to help you get your one. Let's get one, you know.
Okay.
I think there's a big difference between those two scenarios, you know, knowing what the situation entitles and then being like, oh, I don't know. And when you don't know, you just want to call the office to confirm or check the client care plan to know. It should tell you. So caregivers may assist with over-the-counter medications if a patient asks for it. We can do that. So anything for like pain, ibuprofen. What's another example of over-the-counter medications? Tylenol.
Cough syrup.
Yep. Cough syrup. Pepto-Bismol, you know, for indigestion. Aspirin, ibuprofen, Tylenol. That's fine. Be careful because there's. Oh, sorry.
Topical ointment, like antibiotics ointment, is we allowed to put that on them or?
Yeah, with creams we can. Well, I think that'll come up here in the miscellaneous thing. We are able to help administer creams and ointment that they have because we're not going to make Mr. Jones, who can't even touch his ear. No, Mr. Jones, I'm sorry, I can't help you. You're going to have to do your own back.
Okay.
Yeah,
Even if it's like doctor prescribe it, we allowed to put it?
Yeah, we are allowed to
Okay.
help with creams if you have gloves on.
Okay.
I just be careful with ibuprofen because you get some clients that are like, I got pain. Get me 8 ibuprofens. I've had it happen. Yeah, I've had it happen. It's like, Mr. Jones, I don't want you dying on my shift. No, thank you. And then always document with over-the-counter meds. That's important. Mr. Jones had some pain in his knee. Looks like he always takes ibuprofen. I gave him an ibuprofen at 1 o'clock. Well, record it, liable, boom. It's finished. You're done. We'll talk about your question here. I think this addresses it. So nebulizers, like we talked about, they deliver medication in the form of mist that we get. And nebulizer medication comes in the form of a pre-dosed sealed vial. Caregivers may not measure medication into a nebulizer cup that is not pre-dosed. So what that means is we can't mix, we can't find stuff and mix it. But what we can do to help out, has anyone worked with a nebulizer before? Got a few people. I've worked with some nebulizers with some stroke patients that we've had. Did it come pre-dosed in yours? Yeah. Right. I know sometimes it's not. Like sometimes if they need something, there's medicines that you mix. So that's something that we don't do. But if it's pre-dosed, all we're doing is that's it. So we can help with that. Because a patient with a stroke or a heart attack, might not be able to do that. So we can definitely help with that. So caregivers may assist by opening and pouring a pre-dose vial of medication according to a predefined schedule. And that's true. Also, I've also seen medications, I don't know if you guys have seen this in the field, where there's a schedule. It's like all the medicines, it has a packet, and the packet is like on a roll, and all you do is take the medicine for the day and give it to the client, and then they open it. That's nice. When I have clients like that, I'm like, oh, that's so nice. I wish all my clients were like that. You just look at the date. Yep, that's today. Give it to them, and boom. That would be ideal. If every situation were like that, that'd be really nice. Yeah. But different hospitals, different programs, and then they have doctors here, doctors over there, nurses, it's complicated. But hopefully they have a family to help out with that. If they don't, client care manager, that's their job. Okay, and caregivers may turn a nebulizer on and off and clean the nebulizing tube. Has anyone cleaned a nebulizing tube before? Yeah, very simple, put it underwater, and it can be like a first you're like, wait, what do I do? But it's rather simple. Skin, this goes to your question. With pain patches, caregivers may not apply the patch or remove it. That's the hard thing because it's a doctor prescribed thing that we have. So what we're expected to do, caregivers should assist by opening the package with gloves, and caregiver may verbally remind the client that he or she needs to apply the patch. I don't know, a few years ago, I think there was like a lot of gray area with that, and then there was finally a law passed by this. So this is the state of Ohio when it comes to patches. We can't do it. Too many situations that went south with that, so that's why. But yeah, you have something to say, I can tell.
What about a patch that stays on for 1 week and it has to come off?
Can they take it off themselves?
If
many
they're
times?
not able to, let's just say, like I said, a person's with Parkinson or dementia,
Mm-hmm.
they have blood pressure patch, and it has 1 week on, and or 7 days on, and then it's off. So what do you do in that? Call the
Well,
family, or
I would try to call a family and be
Family
like,
or
hey, the
care
patch
manager.
needs to come off. It's because here's the problem. Here's the problem with that. I'm just giving a potential problem. You think, oh, has it been a week? You take it off. Oh, Martha, it was 2 days left. And then you're liable for that. So that's where you got to double check. Double check with that.
I had a client, she was bedridden, and she needed a patch on her heel. And of course she couldn't do that. So I did it.
What a lot of times happens in these situations, everyone gives me like the worst case scenario that they found. So I had a client, the doctor needed a patch right on the back, and obviously she didn't have. So in that situation, I would tell the client care manager, and this is rather new that we're implementing, and that the state of Ohio has enforced this year. So this is something where if that's the situation, I call the client care manager, and I say, listen, this is the situation. Is there a family member that's supposed to do this? Because, if there's a patch there, most likely they need it done a lot, So call and be like, I don't want to be liable for this. This is the state of Ohio. Do you want me to do this every time? I'm not expecting you to. So is there a family member that's coming in that's doing it? Or is there something I don't know about that the client can actually do? Or is there a neighbor coming in, or are you coming in to do it? Because we have client care managers now that are going in and helping and doing that with patches. That's a hard one, That's hard. But that's what the state of Ohio says that we can't do. So knowing that, that's the gray area.
and then Mike, you have to be careful. Also removing a patch, it could pull the skin off.
Right. That's the big thing. That's why. That's one reason why we don't apply or remove it, because of that. It's yeah. So, I always try to stay away from patches if possible.
Mm-hmm.
If possible, I just don't want to be liable. I've seen too many situations go south, and I want to protect the client and the caregiver, but I'm also protecting myself too. So we can help with eye drops and ear drops by placing the prescribed number of drops. We're not going to expect Mrs. Jones to try to eyeball it and get it in her ear. Just double check the number of drops that she needs. It's very small, not too many. And then I don't know why it's not here, but the creams, we are allowed to help with the cream, the prescription cream that they do have. Make sure you have gloves on when you do it. Yeah. It's hard to overdose with cream, you're just applying the cream that they have. So cream's fine. Okay. Any questions before we continue? Pretty good. I know, it's difficult, and I've had severe cases like yours before where I go and I'm like, what do I do? So I'll have a conversation with my scheduler, and we'll have a long talk about what's expected of me in the shift. And what has had to happen many times is the scheduler or the client care manager, they call the family, and then the family writes up, talk about it, because caregivers, rightfully so, are uncomfortable with the situation. They need to protect themselves, so they write up a program, a plan of action, and I'll go into the shift, and right there they have it. Monday, Wednesday, Thursday, the neighbor's going to come in to do the patch. Tuesday, Thursday, the nephew comes in. That's what's happened many times in my case. So if it's doubtful and you have a question, always just call and double check. It's worth it. It's worth doing that. Okay? All right, do's and don'ts. This might be, I think, on that. Does everyone have a paper quiz, medication quiz that they got? I don't know if everyone got one. Maybe it's on the table.
She said only some people take that.
Only some people. Oh, that's a,
It's totally different.
oh, I'm sorry. I have, here I am confusing you guys. I got the medication quizzes too. All right. Too much of a liability.
Yes, I know.
All right, so just sign your name and sign the date.
Yes, it was. Yes, that's what it was.
I'm sorry, what was your name? Rebecca asked a good question that I'm just going to follow up with. She's like, can we cut their nails too? Because we get clients that have claws when you get there. Fortunately, we can't cut their nails. We're not under the scope of practice. We can't do that. We can file them though, so we can help file them to reusable. We can't cut it. Too much of a liability. And also on that note, we can't shave with a razor. We can use an electric razor to help them with that. So, too many cuts. All right, if everyone's ready, we'll go with the medications, do's and don'ts. So someone shout out the answer. Can we assist with medications that we are not familiar with? Nope. No. Do not. So someone was like, well, in that case, I'm never going to help out with medications because, I'm only there for a 2-3 hour shift. What that just means is, you're going to, Mr. Jones needs help transferring. Hey, pass me that. You'll pass. You'll pass. Overstep legal boundaries if a patient asks you to. No. But what if Mrs. Jones asks you so nicely? She's so sweet. So do not overstep legal boundaries. Number 3. Remember the 5 right principles. I cheated. It gives the answer there. Do remember the 5 right principles. Ensure tasks are within the scope of practice. Are these the? I'm just making sure this is going with the slide. I guess that's a little bit messed up. We'll do these first, and then we'll go back to the slide. The caregiver should cut or crush pills if the nurse or family member forgets to do it. False. We never crush pills. Never, never, never. Number 7. The caregiver should document the medications at the end of the shift. I think that's a tricky one. They're trying to confuse you.
It should be when they take it.
False. So it's false because it should be right after.
Right.
Because if they're taking it 3 times a day, you're on a 12-hour shift, you'd be like, what time was that again? It's a long day. So right after the medications are taken. Number 8. So 7 is false, by the way. 7 is false. Number 8. Patients have the right to privacy when taking medication.